Hi, good evening, everyone. We're so excited to have you join us tonight for the Hoag Healing Breast Cancer Survivors Empowerment Series. It's a great virtual series that we've been doing for the last few years, ever since basically COVID. We definitely miss all of the fun in-person events, and we're hoping that soon enough we can get back to at least some in-person events, maybe in a smaller setting so everybody can be spaced out. So please look out for more information about some upcoming programs. We have an amazing program for you tonight with two wonderful speakers, and I'm super excited to introduce them both. Before we get started, I do want to say that if you have any questions, we really want these events to be interactive and for you to get an opportunity to ask questions and be involved. So both of the speakers are going to be answering questions in the question and answer at the end of the event. So if you think of questions or you have any questions for our speakers, please enter them in the YouTube chat box below. And we will definitely try our best to get through all of the questions, but I think that makes it more fun and interactive. And we want to make sure that we're answering any questions. You'll also be getting a survey later this evening, and we really want you to, it's only a few questions, and we would love to hear any feedback, but mostly if there's any other topics that you want us to cover or there's speakers that you would like to suggest, we would love to, feature what's relevant to you. And thank you again for joining us tonight. The events or this virtual event is going to be recorded. So if you miss parts of it or you can't stay till the end, you can always go back to the Hoag YouTube channel and watch tonight's event or any of our previous events. So thanks again for joining us. And then we have two amazing speakers for you tonight. So I'm going to introduce both of them. Maybe I should start with introduce myself. I'm Dr. Sadia Khan. I'm one of the breast surgeons at Hoag, and I am the program director of integrative breast oncology. And I'm super excited to then introduce our two speakers, Dr. Neda Mehr, who's a friend and a wonderful board certified dermatologist who's been in practice for over 10 years. She's amazing and is awarded top cosmetic dermatologist in Newport Beach. She focuses on helping patients feel more comfortable and beautiful in their own skin. She prioritizes educating patients on the importance of merging holistic medicine and science. And Dr. Mehr specializes in offering the latest and cutting edge anti-aging technology, as well as practicing forward-thinking medicine. So we're super excited to have Dr. Mehr with us tonight. Our second speaker is Preeti Soni. She's a registered dietitian, and she has over 12 years of professional experience. She uses a client-centered model of care, incorporating evidence-based nutrition principles. She also helps patients of diverse backgrounds. She specializes in diabetes medicine as well. So Preeti tries to be inclusive and culturally relevant. She incorporates wellness and focuses on identifying the root causes and imbalances that improves patients' outcomes. And she's very passionate about helping people nourish their body. So we're really excited to have both of these speakers tonight, and we really hope that you enjoy the talks. So I'm going to let Dr. Mehr get started. She's going to be talking to you about health of your hair and skin. And then please write down any questions that you have in the chat box, and then we're really excited to hear you talk, Neda. So I'll let you go ahead and get started.
Well, thank you so much, Dr. Khan. I just love doing these series with Hoag. And yes, I can't wait to get back to non-Zoom status. But for today, I would love to address how to get your skin back after cancer. And next slide. First thing is, I just wanted to introduce that Dr. Khan and I have known each other for a while through Hoag. And one of my favorite quotes is just, I believe that one woman's success could only help another woman's success. So I wanted to thank you, Dr. Khan, for inviting me to be a speaker here. And I go ahead and let's do the next slide. Let's get started. So really the problem here is surviving breast cancer is enough. We have 20 to 30% of breast cancer survivors that really report what's called late alopecia, which is defined as incomplete hair regrowth 6 months after their last treatment of either chemotherapy or hormone treatment. And the issue with this isn't the fact that they're just losing their hair and it's persistent. It's that quality of life measures have been taken and they report a significantly decreased quality of life due to the alopecia or hair loss, as well as they are actually requesting from their breast surgeons, like Dr. Khan, you know what? Let's reduce the dose intensity of our cancer therapies. So that's an issue. They're really willing to even reduce their dose intensity of chemotherapy because of this issue. So next slide. Let's get into why chemo causes hair loss to begin with. So when we talk about chemotherapy, when we talk about cancers, we're talking about rapidly dividing cells. When we have cells that divide too quickly and they become aberrant, then they become cancerous, right? Well, in our bodies, naturally, we have certain cells that are, dividing too quickly, and that's going to be the hair follicles. Our hair follicles are dividing quickly because we've got 3 stages and they're constantly cycling our hair, which is why we can lose up to 50 to 100 hairs a day. But the problem with this is when individuals go through chemotherapy, it causes the healthy skin cells and healthy hair cells to also die off. And this causes damage to the hair follicles, which a lot of our patients say, I have a sensitive scalp, my hair is thinning, I'm losing a ton of hair. And for some people, it's just patchiness, which makes them uncomfortable, thinning, even bald spots. And sometimes, very rarely, can it be permanent. So basically, if we go to the next slide, please, a lot of times patients report that they lose their eyebrows and their eyelashes as well. And so this was a fun slide that I found online from a patient just because she was so great at documenting how the hair grows back after chemotherapy. Well, you could see her right after chemo, 10 weeks later, 5, 6, 7, 9 months later, and of course, 13 and 2 years later. So yes, the hair typically does grow back. It typically grows back 3 to 6 months after the treatment ends, but it can grow back differently. And so a lot of times people report, I'm associated with the cancer center here at Hoag, and I'm on their advisory board. And so what happens is I get a lot of patients after they go through different types of chemo, especially breast cancer, and they come back, they're, thinking, well, this was not my hair before I started chemotherapy. And yes, it could grow back just different. It can grow back thinner. You can have a decreased volume of hair. It can grow at different growth rates. And you can have patchy spots, bald spots, and there's something called chemo curls. And I thought that this slide represented it nicely, where, you could see, towards the end of the slide, she had completely straight hair, but throughout the course of it, her hair texture was different. And a lot of times graying occurs. So the key, my expert tip is avoid hair dyes, perms, bleach, anything that's harsh to your scalp when you're post chemo and as your hair is growing back. So one of my favorite products over the counter is called Vanicream, and it is really fragrance free and is one of the most excellent sensitive scalp products out there. Next slide. So what can we do to prevent this from happening? There is an FDA approved treatment called cooling caps. And the way this works is that when we have cold treatment, what that causes is vasoconstriction or tightening of the blood vessels in that localized area. So the theory behind this cooling caps is because chemotherapy can't tell the difference between cancer cells and normal cells that divide quickly, what happens is if we just do localized cooling of the scalp during the infusions of chemotherapy, then patients have been reported that 50% of them using these cooling hair caps during their chemo infusions don't develop any form of alopecia. And this is really important specifically for breast cancer patients because almost all chemotherapies for breast cancer cause total hair loss. And so that's why these cooling caps are most common in breast cancer patients. Next slide.
Neda, can I just say a quick comment? I think this is so important because I always try to mention this to any patients that I know will undergo chemo because it's not actually something that's commonly known. And if a patient doesn't know to ask about it, they may not know or found out about it till it's too late because they've already started chemo. So I think this is a huge, important concept for patients that will be going through chemotherapy. And it's such an amazing advancement in treatment options.
Yeah, it really is. Thank you so much, Dr. Khan. Yes. Next slide. So the main points on these cooling caps, just to piggyback on what Dr. Khan said, is you really have to start at the beginning of chemotherapy. And it's a cap-like device worn on the head during the infusions. There are FDA-approved ones, and it's best for prevention. The results are permanent. So once you don't get those debilitating chemotherapy effects to your hair follicles, then you get to keep your hair. And the downside is that, it can cause discomfort during the treatment, neck and shoulder discomfort. It can cause forehead pain, dizziness, nausea. And of course, the downside is typically not covered through insurance. The average cost is about $2,000 to $3,000. Next slide. So you still have hair thinning, now what? And so this is a funny picture. So my husband is a hair transplant surgeon, and we were asked by one of the companies for a low-level laser light therapy device called HairMax. They called us up one day and said, hey, you guys are our favorite hair duo, dermatologist, hair transplant surgeon. Will you join us to be on a commercial with Fabio and discuss, photobiomodulation? And so I have no affiliation with the company, but I thought it was funny and I thought it was great. It was just so fun to educate and to, spend the day in LA with Fabio and my husband. So let me tell you a little bit about what this is. So low-level laser light therapy is otherwise known as photobiomodulation. And this technology was actually discovered on accident, which is funny because a lot of things in medicine were discovered on accident. When a researcher was experimenting with a newly invented Ruby laser device on mice with tumors to see if the tumors would shrink. And instead he noticed, wow, they have a huge tuft of hair growing in the area that we're using this nanometer of light. And they have an incredible wound healing in this area. Next slide. And so, of course, came out this device. You wear it 3 times per week for 15 minutes. And I love it as a maintenance procedure. What does that mean? If you're doing, hair restoration, if you're doing different treatments, I don't like it. I don't like my patients to use that during the treatments, but it's excellent to start using about 4 weeks later, or for patients who choose not to do any treatments and to just use the photobiomodulation. And there's some different companies that have it. Capitalist is one of them. Here is one of them. And so is HairMax. So if you guys have noticed and you're, interested in hair, then you probably have seen this New York Times article that an old medicine can grow hair for pennies a day, doctors say. And what is that? So this medicine is called minoxidil. Minoxidil is actually Rogaine. It's well known as, Rogaine. And back in the day, in the 70s, I believe, there was another accidental finding. Rogaine or minoxidil. Minoxidil is actually a vasodilator, so a blood vessel dilator. So if you remember what we talked about for cold caps, it was the exact opposite. Closes the blood vessels in the scalp. When we talk about hair loss and hair techniques to grow back the hair, we want to enhance the blood vessels in that area. That's how low-level light works. That's also how minoxidil works. So what minoxidil does is a vasodilator. So it dilates the blood vessels and it enhances blood flow to the scalp. So it was discovered as a blood pressure medicine. So it smooth muscle relaxer, it relaxed the blood vessels. And they noticed, gosh, these gentlemen in the ICU who are getting minoxidil IV, they're growing their hair back. And so, of course, now we use it off-label to regrow people's hair at significantly lower doses than is needed for blood pressure. So what do? We use it next slide. We use what's called LDOM, or low-dose oral minoxidil. And there's tons of literature out there using it for breast cancer patients and cancer patients in general. We use it off-label typically for androgenetic alopecia or pattern hair loss due to genes. So if your mother or your father's had any hair loss, it's typically because the blood vessels to those patterns are typically deeper down in the muscle layer instead of being in the skin. So the hair thins out and dies off. Well, minoxidil has been used off-label for them, but also specifically lots of studies have come out that we use it for people in chemotherapy. In fact, a recent study was done over 216 patients on either chemotherapy alone, hormone therapy alone for breast cancer, or both hormone therapy and chemo. And a whopping 74% of women had new hair growth by being on a low dose, 1.25 milligrams a day, of oral minoxidil. That's amazing. Really, really good results. So there's current clinical trials that are showing that topical Rogaine is almost negligible. In fact, for the cancer patients, topical Rogaine with oral minoxidil and oral minoxidil alone have the same results. So really at this point, you really don't need to be doing anything topical. The results peak at about 104 days, so about 3 to 4 months after beginning the minoxidil. And there's very few side effects. Really, I tell patients if you have a cardiac history, I wouldn't want to start you on it unless your cardiologist approves, because I don't want to give you a blood pressure medicine if they already have your blood pressure controlled. But other than that, less than 5% of patients develop palpitations, lower leg swelling, and dizziness. And about 10% of patients develop hair growth in other parts of their body, which to this day, I haven't had to take anybody on minoxidil off oral minoxidil for any form of side effects. Next slide. So the key with oral minoxidil is that it enhances new hair growth, but studies have found it does not increase the thickness of your current hair. So a lot of times we don't necessarily need to grow new hair, but we want our own hair to become thicker like it used to be, because as it thins and falls out, it becomes more superficial and thinner. But as it gets deeper down into the skin, the dermis, a healthy hair follicle, is thicker. And so how can we improve the thickness of patients' hair? We do that with PRP. Now, most patients who've had chemotherapy or who've experienced this hair loss, their hair, again, chemo changes it, thin, friable, breaking off. And so when we do treatments like PRP to them, we've seen really excellent results. It increases both the hair count and the hair thickness, as well as extends the period of time your hair is in the growth phase. So we have 3 phases of hair. We have anagen, which is growth, telogen, which is kind of between anagen and catagen. Catagen is falling out. So it enhances the length of time your hair is in the growth phase, and we all want that. So clinical trials for breast cancer and hair loss are currently underway with the treatment of PRP. It is considered off-label and it's not covered through insurance. It's typically twice a month for 3 months, and the cost varies per area and per treatment. We do a lot of it in our office, so we're able to offer really low rates for our patients. Next slide. What about supplements? So when it comes to supplements, most experts agree you really just want to have a healthy nutrition balance on the inside. The hair and the skin is an external manifestation of your internal health. And obviously, having gone through chemo or having a form of hair loss means there's probably something going on the inside. And so most experts agree we want amino acids, we want biotin and other B vitamins, we want iron. So a lot of women who go through iron deficiency, anemia, all of that, we want to check their iron and make sure they're optimized, as well as omega-3 and omega-6 fatty acids, vitamin A, C, D, and E, and oral zinc. And so that's part of our typical blood work that I check for every patient when they first come in our doors. Some of my favorite supplements are Nutrafol and Viviscal, because they have clinical trials backing up their efficacy for hair loss. Now, another important factor, especially because I deal with so many females with hair loss, I've had hair loss, I'm constantly struggling with it. And it's really important to talk about diet. And I love that Preeti is going to talk about that a little bit later. And as for me, I just want to reiterate, it's very important to have proper protein intake. Hair is made out of a protein, you got it, and it's called keratin. And if we are not consuming adequate amounts of protein, it's certainly not going to get to our non-vital organs like our hair. Our body is smart. It's going to preserve it for our vital organs. So it's important to consume proper amounts of protein. And there's an online quick conversion that you can do if you type in your weight in Google. How much protein should I be taking for my weight? Next slide. So, of course, if all efforts fail, surgical hair restoration is something that we do for a lot of our cancer patients, a lot of our female patients. And I wanted to kind of go over chemotherapy-induced alopecia. It is typically temporary. It typically comes back after 3 to 6 months and you begin to regrow your hair. But again, we discussed late alopecia, meaning beyond 6 months of hair loss after your last chemo or your hormone treatment. That happens in about 25 to 30%. So what do? I like to do medical therapy with the oral minoxidil. I like to do topical therapy with PRP. I like to do anything non-invasive first. I like to make sure that they have adequate supplementation, that internally their labs are okay, that they're maintaining on a good hair cap, the photobiomodulation. And of course, lastly, hair transplantation, especially if it's persisted beyond the 2-year mark without adequate regrowth. So what do we do with hair transplant? There's two main ways we do hair transplant. One is called FUE, one is called FUT. What's the difference? Women, we typically do FUT, follicular unit transplant. What does that mean? We take a strip from the back of the hair, we take out those hairs, we harvest them, and we put them back into the sites that we are seeing the loss. That's typically what we do for females. For males, we typically do something called FUE, which is unit by unit, we take it in the back. Why? Because they don't really want a scar on the back of their head. And why don't we do the FUE for females? Because they have to shave their head. And, we don't really want that for our female patients. So because breast cancer survivors also complain of eyebrow and eyelash that they're not growing very well, we start them on topical Latisse. And so that is helpful. But again, if by the 2-year mark they're not growing it, then we do eyebrow transplants. Now, eyebrow transplants are a little bit different. We take it again from the hair, the back of the hair typically, and we put it in the brow. But remember, this hair grows at a different growth phase than the eyebrow hairs. So the one thing to note about eyebrow transplants is you're going to have to kind of cut it and groom it a little more than if it were, a original eyebrow hair. Next slide. Oh, and that's my husband performing hair transplant. So counteracting hormone and chemotherapy for skin aging. I've got a couple slides on this. Essentially, most of the chemo issues are with hair. We also notice it with skin. So what happens to the skin? We talked about dividing cells, and when we shut down those dividing cells with chemo, or specifically induce menopause in premenopausal women that we're treating for breast cancer, what happens? All those positive effects of estrogen are gone. Well, what are the positive effects of estrogen? The positive effects are it really enhances the fibroblasts, the collagen producing cells, to produce collagen. That keeps the middle layer of our skin, the dermis, thick, healthy, vibrant. And when we don't have the estrogen, it becomes thin, sagging, crepey, fine. And we start to notice the drooping and we start to notice the lines. So how can we reverse this effect without giving our patients estrogen? Well, we do that by, number one, I talk about nutrition. So again, Preeti, I love that you're talking after, is we drink water. A lot of the epidermis, a lot of the skin is made up of water, and you have to hydrate. The second thing is cut back on alcohol, cut back on coffee, and no fat-free diets. Why? Because that top layer of skin cells, that epidermis, really does not want to be dehydrated. So, minimize alcohol, minimize coffee. And number two, that top layer of skin cells is full of cholesterol and oils. It functions as a repellent for our skin. And if we're on a fat-free diet, then my goodness, we are stripping our skin from all of those good oils. So I supplement our patients with omega-3 fatty acids. Next slide. And talk about good diet. And if you saw the slide beforehand with the avocados and all that good food, that's really important for patients with breast cancer. So patients with breast cancer also complain that their skin is drier and itchier, and that they're significantly more sensitive to the sun, and they hyperpigment. So what do? I always warn them, don't worry right now, because during the infusions and chemo and all of this, you are going to experience these skin changes because it's selectively killing any rapidly dividing cell. And at this time, that's not just your hair, it's also your skin as well as the cancer cells. So it's good that it's working, but you want to replace with a second skin all that moisturizer. You want to minimize hot showers, exfoliation, anything that's irritating to the top layers of skin. And this is my favorite over-the-counter moisturizer that's fragrance-free. It's called Vanicream. It's readily available online, Walgreens, Rite Aid, anywhere. And it happens to also be the same brand that I love for shampoo and conditioner in patients who are, during and post chemotherapy. And remember, in the meantime, avoid exfoliations, strong topicals like vitamin C, retinol, alpha and beta hydroxy acids. Opt for nourishing, hydrating, simple creams like glycerin, ceramides, Vanicream. And don't forget your SPF. But, more importantly, don't forget that physical protection is always going to be better than a sunscreen. Wearing a wide floppy hat, long sleeve, breathable clothing when you're outdoors, and putting on a non-toxic sunscreen that's mineral based is going to be important. And that's why I like Vanicream. Next slide. We talked about this already. You can see the skin effects of skin aging that happens with estrogen loss. Next slide. And of course, what are the best skincare while on hormone therapies? It's going to be gentle cleansers, fragrance-free moisturizers. And of course, this was a warning that is just out of the literature that I really wanted to share with everyone. Be very careful. If you have a history of breast cancer or you're a survivor of breast cancer, there was a report in the Journal of Clinical Oncology that warns that rejuvenating skin creams often contain estrogen. In fact, a whopping 40% of them contain significant amount of estrogen. Why? Because estrogen helps you retain water, like we talked about. But if you have a history of breast cancer, you don't want to be then applying topical significant amounts of estrogen, especially when you're on a daily hormone therapies for this. So please, be cautious about what you put on your skin. And of course, I love those Vanicream if you have this history. Now, how can we do skin treatments that can help? First of all, skincare at home is going to be 30 to 40% of the battle. If you don't have breast cancer and you're after chemotherapy and all your treatments are done, I love, exfoliating once or twice a week. I love retinols. I love vitamin C. I love growth factors. I love alpha beta hydroxy acids, just not during chemo. So that's going to be 30 to 40% of the battle. Now, 60 to 70% of the battle is how are we going to get our skin back? So there's treatments that are non-invasive called thermage. They build collagen. You can do it on your face, your eyes. A lot of our breast cancer patients love this. It's not an injection. It's not a filler. It's not Botox. It stimulates your own body to build collagen. And, no downtime. Last year when I turned 40, I started, to do it on an annual basis. So every Valentine's Day, I get it done. So next week is my appointment. It's great. Now, Ellacor is a new device, and it's basically great for our breast cancer patients because, again, no injectables. What we do is it takes off about an inch of skin on each side, and that helps with the laxity that happens after, induced menopause or postmenopause or hormone treatments for breast cancer. Next slide. Well, that's all I got, guys. This is a picture of my husband and my kids and I just wanted to remind all you powerful ladies out there is no force more powerful than a woman determined to rise. And that's all of us here. And
awesome.
That's all of you guys.
Thank you so much. What an amazing talk. Thank you, Neda. This is great. And I love seeing pictures of your family, and you had such amazing content, and we're really excited for all the things that you've shared tonight. We've got a few questions already in the chat box, but feel free to continue adding in any questions that you guys want Neda to go over or Dr. Mehr to go over at the end of our talk. So thank you so much. I'm going to invite Preeti to start talking and to give us some information on vitamins and supplements, which is always a hot topic, and it's things I get asked about all the time. So I'm very much looking forward to this talk, and I'm going to let you get started.
Hold on. Thank you, Dr. Khan, for giving me this opportunity to talk. And Dr. Mehr, I loved your presentation. I'm so glad you did mention that diet plays a very important role in healthy skin, healthy hair. So that's why I really wanted to talk about this topic, vitamin and supplements to enhance your survivorship journey. I just wanted to show you something, and I did collect some of them from my friends. How many of you have these kind of boxes? I think most of us have these kind of boxes where we have tons of vitamin and supplements, and we don't know exactly what they're for, or just taking because our friends recommend it or we read somewhere. So that's why I wanted to pick this topic and clear some of these myths, and also give you more evidence-based guidelines and recommendations so you can make a better decision what supplements and vitamins to take. And next slide. And also, did you know that 50% of Americans use dietary supplements, and 70% of cancer survivors use some kind of dietary supplements, and 80% of women cancer survivors use supplements. And vitamin and supplement industry has become insanely crazy. It's actually right now 39.8 billion industry right now. So that's why I really wanted to talk about research-based findings related to the use of vitamin supplements during survivorships. And also, a lot of times we are confused. What should we ask our doctors or dietitians? So I have prepared some of the questions to ask and provide you more dietary recommendation, which is more evidence-based, which have been proven to prevent cancer. Next slide, please. I just want to tell you that I have no financial disclosures or conflict of interest with the presented material in the presentation. Next slide, please. Okay, so multivitamins, that is one of the most commonly used vitamins by any average American. And basically, we take it because we think that we are not eating enough vegetables or fruits, and then we want to keep our levels in balanced levels. So that's why we take it. But I just want to tell you that a number of studies have examined the question as to whether what multivitamin use reduce the risk of breast cancer. According to Lay's study, taking multivitamins in 2 years after the breast cancer diagnosis was not associated with any adverse outcomes. And this is a very big women health initiative study, which said possible role of daily multivitamin use in attenuating breast cancer mortality in women with invasive breast cancer. But the findings requires more confirmations and more study. Remember, multivitamin use may or may not prevent a reoccurrence, but antioxidants like vitamin A, D, E, K during radiotherapy or chemotherapy may promote it. So possibly avoid the use of antioxidants during chemotherapy or radiation therapy. And I would tell you, obtain most of your vitamin and supplements through food rather than taking multivitamins. And, always just if you're curious, maybe you're feeling more tired or you're thinking, maybe I'm deficient in some vitamin, make sure you go to your doctor and get those tests, like common tests like iron, vitamin C, not vitamin C, but more like vitamin D. Sometime getting more like if you're folic acid deficient. So getting those lab tests actually will help you get exactly what you need to increase in your diet, and maybe you need a supplement to help you boost those levels up. Next slide, please. Vitamin C, I know during COVID time, the vitamin C has become one of the most commonly used supplements, and women use it for better skin. But I want to tell you that higher dietary vitamin C intake is significantly associated with reduced breast cancer incidence and mortality. The intake of vitamin C supplements has no significant effect on breast cancer preventions, and vitamin C supplements should not be taken during radiotherapy, chemotherapy, or tamoxifen treatment. Common sources of vitamin C is anything like your orange juice, Brussels sprouts, strawberries, potatoes, sweet potatoes. Make sure you include more of those in your diet versus taking a supplement. And if you have to take then mostly it's recommended, like daily recommended intake should be more like 75 milligrams per day, and it will help you. It plays an important role in your immune system. Next slide, please. Vitamin A, as we know, that it helps with eye health, with healing. And so a lot of people take vitamin A, but make sure if you're not deficient in vitamin A, you should not be taking it. A systemic review and meta-analysis said that there's limited evidence for the significant inverse association between pre-diagnosis dietary intake of beta carotene and overall survival among women with breast cancer. Intake of other vitamin A derivatives are not significantly associated with survival. Studies of vitamin A show no effect on breast cancer risk. If you take too much of vitamin A, there are some side effects. You may experience nausea, vomiting, headache, and taking a very high dose of vitamin A may also put you at a risk for osteoporosis. Vitamin E is used to help lower the risk for heart diseases and possibly reduce the cancer risk. It is also used to treat menopausal symptoms associated with treatment of breast cancer. 400 international units or more per day of vitamin E is associated with an increase for stroke over time. So be cautious of taking too much of vitamin E. And then vitamin E does not appear to be effective in treating hot flashes in women who have had breast cancer. Next slide, please. All right, that is the most common vitamin D supplement is vitamin D and calcium that a lot of women take, whether it's premenopause or postmenopause to help with their bone health. It has been seen that the early vitamin D supplementation could help maintain bone health as well as potentially enhance the cancer survival rate. Post-diagnosis vitamin D supplement use was associated with improved overall survival, but not progression-free or cancer-specific survival or relapse. A calcium supplement with vitamin D helps your body absorb calcium and may protect bones from changes due to treatment. And I also want to tell you that calcium and vitamin D may help protect premenopausal women against breast cancer. But again, more studies needs to be done because there are more animal studies than human studies. Low level of vitamin D are associated with high risk of breast cancer. So make sure when you are getting for your annual checkup, get your vitamin D supplements level checked. And then if you are taking booster doses, making sure that you don't continue taking them, but periodically getting your vitamin D level checked so that you know that you're not getting toxicity. Because if you absorb too much calcium, then it's a risk for heart disease too. There's a new supplement in the market which has come up which says vitamin D with K2. I know a lot of patients have now transitioned from regular calcium vitamin D supplement to vitamin D with K2. Basically what K2 does, it helps to absorb that calcium into the bones. It's like a carrier. So just make sure that you consult with your doctor, because vitamin K, if you are on blood thinners, it may not be appropriate to take that kind of supplement. Again, mega doses of vitamin D appears inadvisable unless you have very low vitamin D. And also want to tell you that if you take a calcium supplement, like say 1,000 milligrams, don't take the whole dose in one time. Make sure you divide the doses in two times. Maybe take 500 milligrams in the morning and 500 milligrams at night. So it helps with better absorption. And then most calcium supplements are best absorbed when taken with food. And calcium citrate is a form that can be taken either with food or on its own. And don't buy the calcium tablets that are made from bone, coral, or dolomite, because they may contain lead and or other harmful metals. So be careful when you look what is the source of calcium. Next slide. All right, so that was all vitamins, commonly used vitamins, but there's a huge market about all these natural herbs have come up in market. And now people trying to take these supplements to help with their symptoms, whether they're during chemo, they're feeling more lack of like energy, a lack of stamina. So they're kind of incorporating these without knowing whether it is appropriate for them or not. So I want to discuss some of the common herbal supplements for you guys. Most common one is the echinacea. It helps with basically stamina, and flowers, leaf, and stem is used for medicinal purposes. Echinacea seems to be relatively safe. You can take up to 10 days, I would say, but try not to take too much of it. Again, if you are a person who have compromised liver, or if you take too much, it may cause some liver damage. So be cautious of taking that. Next slide, please. Garlic. We all consume garlic. Just remember, garlic is like a superfood. It has so many good properties. It is anti-breast cancer effects. It is like, I can say so many things about it, like antimicrobial, anti-thrombotic. It helps with your lipids. It's anti-inflammatory, and it also helps with your blood sugars and improve your immune system. But here's the thing with garlic: try not to take like supplements for them, because if you are on a blood thinner, then taking excessive garlic will not be very helpful. But if you are doing raw garlic, make sure you either cut them or crush them for benefits, because that's when the better. There's a special compound, organ sulfur compound, that is generated upon cutting or chewing of the garlic. As I said, garlic should not be taken if you have increased risk for bleeding and you are on anticoagulants. Garlic supplements have been shown to reduce the clearance of chemotherapy drug, and the beneficial effects of garlic on cancer has been mixed. So again, we need a little bit more study before we start taking in huge amount or taking as a supplement. Next slide, please. Curcumin. I grew up with turmeric, by the way. And I am so amazed to see that now turmeric is everywhere, is either in liquid form, in capsule form, in powder form. And people really don't know like how to use it. Remember, these herbs and spices are very potent, okay? They should not be consumed in significant, like higher doses. My best recommendation to use turmeric would be with food, whether you can add it to your soup, in your latte, in your curries. And that's how I grew up taking it. So not in form of a supplement ever. But it is an amazing superfood. And there are some studies have shown that it has anti-cancer actions against several types of breast cancers, including hormone receptor positive, triple negative, or HER overexpressing cell lines. Adding curcumin to some chemotherapy regimes have shown to enhance their cytotoxicity. It helps to reduce that foggy, the chemo brain, but it does sometimes interfere with effectiveness of tamoxifen treatment. So make sure if you are taking as a supplement, you check with the doctor. It does not lessen the radiation effectiveness and could be beneficial. Again, my huge recommendation is consider turmeric as a spice and not as a supplement, like in pill form, or it would be better. And make sure you buy like more organic turmeric then, because it can be also in high metals. So you want to be avoiding that metal toxicity. So that's why it's really important. And also I came across that if you combine black pepper with turmeric, it increases the anti-breast cancer action and enhancing a breast cancer cell sensitivity to curcumin. Next slide, please. Flax seeds. Flax seeds are a great source of omega-3, and it is a great source of fiber. So I always encourage people to include, especially if you're not taking enough fiber in your diet. And there's no specific recommendation like how much to take in. So you can take like 1 or 2 tablespoons a day, but make sure you drink a lot of water with it. It is thought that the lignin in flax seeds may bind to estrogen receptors and may reduce the risk for breast cancer. And some studies have suggested that it reduces cell growth. Flaxseed is likely safe for women with estrogen receptor negative breast cancer. All those benefits have not been proven in clinical studies. Flax seeds can enhance breast cancer treatments. Remember, if you take too much of it, anything of too much, even too good, is not good. So it may cause you some like stomach distress, or if you are allergic, then you may have some reaction to it. Next slide, please. Green tea. I love green tea. I'm very sensitive to caffeine. So there is a polyphenol compound called ECG in green tea, which may reduce the risk for breast and other cancers. And typically it has like 25 milligrams of caffeine per day. A safe intake could be between 3 to 4 cups per day. Excuse me. And in the lab and animal studies, it has shown that it limits the growth of breast cancer cells and other types of cancer cells. One study of Asian American women found that those who drank more green tea were less likely to develop breast cancer. Again, much more research is needed to know how green tea consumption may influence the breast cancer risk. Next slide, please. So ginseng is another very popular supplement that people have started including in their as a supplement. There are 2 kind of varieties. One is Asian, one is American. It is claimed to boost the immune system and promote that sense of well-being and improve the stamina. But again, the small studies have suggested that ginseng may help elevate the cancer-related fatigue, but there are some common side effects if you experience taking it. It could be headaches, sleep problem, restlessness, like palpitations, or GI problems, or menstrual irregularities. Maybe it's better not to take it. And it may also help lower your blood sugar. So again, be cautious when you're taking supplement for ginseng. Next slide, please. Black cohosh is another one. It's considered like superfood now. Basically, it helps with immune system. One of the clinical trials in women in breast cancer showed that black cohosh gave no relief from hot flashes than a placebo. Preliminary work on individual cells suggests that black cohosh may act on estrogen receptors in some way and is associated with lower breast cancer risk. A 2000 study involved nearly 2,500 women found that the use of black cohosh reduced the risk for breast cancer, but this was the first known report of such an effect. Again, it may interfere with the effectiveness of chemotherapy, so make sure you talk to your doctor before you include this supplement. Next slide, please. I really wanted to focus, on this, like what should you be asking with a dietitian or a doctor when you go and about taking supplements? So maybe ask them, if I take a supplement, will it benefit me? Are my labs levels like enough to, like, are they running low? Should I be taking it? And then again, remember, there is no formal recommendation of doses. So it's more like a clinical judgment by the physician or the dietitians to let you know, like, what would be a safe range or safe dose for a supplement. And you can ask about what would be the side effect, or if I'm taking it, is it going to interact with my treatment and reduce the effectiveness of my treatment? So make sure you ask these questions and make most out of your visit by asking these questions to clinicians. Next slide, please. I love this slide because it gives you a summary of everything that can prevent you from having cancer. The most important one is having a healthy weight. And I know as a woman, we struggle with our weight throughout the life. It's a roller coaster for all of us. Sometimes there are 5-pound weight gain, or we can work on towards reducing, but always try to be in a healthy range. That should be the goal. I'm not asking you to be like in a perfect BMI, but I would say definitely have more muscle mass than fat percentage in your body. And I think that determines the good quality weight. Also be very physically active, try to have at least 150 to 300 minutes of exercise per week. Or if you're doing a vigorous exercise, it should be between 75 to 150 per week. And that should be a good goal to get for. And drink enough water. As Dr. Mehr said, water is amazing. It's actually a superfood, what I should say. It's free of cost. And not many people drink enough water. I always emphasize in my practice, drink at least 8 to 10 cups of water, unless you have a heart condition that prevents, or kidney condition that prevents you from not having enough water. Limit the processed meat, red meat. I know meat industry is really big, but make sure you cut back on the red meat. Try to have like lean protein, chicken, fish, egg, turkey. Those are the better sources of protein. Again, having adequate protein is important. You really don't need to supplement protein unless you are a heavy weightlifter, or you have a compromised condition, you're losing weight. Then maybe you may want to add up more protein in your diet, but try to have a balance between animal-based and as well as the plant-based protein. And I get this question all the time: is tofu safe? Yes, tofu is safe to take. It does not it does not has a risk for causing cancer, but do avoid like soy-based protein supplements, because again, there's very limited studies available on soy isolates. And try to incorporate more vegetables, more fruits, more nuts, more grains, healthy fats, and if your plate look white or it looks brown, I think there's a big problem. So if it looks like a rainbow, basically it has a lot of antioxidants on a plate. And that's when the magic happens. When you take all these different colors in your body, and no supplement can do the magic that a diet does, all these antioxidants from natural food does in your body. So try to have at least 30 plant-based foods in a day. And it's not really difficult. You can actually do 5 or 6 or mixed nuts, put it on your yogurt or on your cereal, or try to do like 2-3 greens mixed together, or try different kinds of grain. Don't just stick to wheat. And again, I do not promote any kind of fad diet. So balanced diet is all you need. Just variety. It's a celebration of having more local, more seasonal fruits, rather than going for an expensive or out of season fruits, because the seasonal fruits and vegetable has the most nutrient in it. It's okay to do frozen ones, because I know we want to cut back on the cost, because they are actually frozen at the peak time. So that would be okay to do it. Again, limit alcohol use. If you have to take 1 serving per day for women, that would be my recommendation. Next slide, please. So I just want to conclude this whole session by saying that dietary supplements are not regulated by US government. A good rule of thumb is to look for supplements that has the third-party verification, which has that USP notation on the label, that might be just saying that it has a better quality and has not too many fillers in it. Again, if something is natural, doesn't mean it's safe. Okay, so make sure you talk to your doctor before you do any kind of excessive amount of these supplements. Talk to your dietitian, and please always share what you take over the counter, because it's really important for the doctors and dietitians to know that. There is no proof of any vitamin or mineral or herbal supplements can treat breast cancer or prevent it from coming back. Again, I really want to say that there's very limited studies right now how medication and supplement interact. So the risks are unclear. And I just really want to say that there needs to be more regulations and more about like how these supplements, how much you should be taking. There should be more guidelines to help individuals make better decision. And again, I really emphasize on wholesome, balanced diet, include lots of fruits, like, balanced amount. I'm saying that over expressing it, but yeah, try to have like a bit more fiber in your diet, more better hydration, fruits and vegetables, whole grains, lean protein, exercise. And that is what is going to prevent you from having cancer or reoccurrence, or improve your survival rate, or improve your quality of life. So I really emphasize on balance. And of course, mental health is the biggest and one of the important thing. So health is just not your diet or weight. It is your mental health, your physical health, your social health. It is a complete package. So making sure you work on all the aspects of health is important to have a better quality of life. And I hope this presentation helps you making some choices or making some decisions based on evidence base, and not rather getting influenced by media, social media, or influencers, or friends, or some holistic person. So I hope this was helpful, and thank you so much for listening to me.
Great. Thank you so much, Preeti. That was a lot of great information. And I think it can get confusing, like hearing about supplements and vitamins and understanding which is right and what's not. And I love that you mentioned that your diet, actually physically what you're putting in your body with food and fruits and vegetables, and having a varied kind of balanced meal, that will be better than any supplement that you can take. I mean, a lot of the supplements, they're great to give you a start, but a very well-balanced diet, getting the natural minerals and vitamins through your food, will actually be better for you to actually absorb the actual nutrients versus when you're taking it in a pill form. So thank you so much for your talk. And we're going to get started with our question and answer. I know we've got some great content, and I've got so many questions to go over. So we're going to kind of quick fire go through and have all the panelists up so we can get through some of these questions. I will try my best to get through all of them. And then anything we don't get through, hopefully we'll have both of you back to give other talks, and we'll get an opportunity to meet with you again. So let me just get started, and then I'm going to, again, try my best to go through the questions as quickly as possible. So let's start with Neda, I have a question for you. So a patient mentioned that their mom went through chemo and radiation therapy a year ago, and their hair is not growing back. And if they do have hair, it's really thin. And I think you did touch about some of this in your talk, but could you just summarize maybe some recommendations?
Yeah, I mean, honestly, I would just double down on thank you so much, on the best duo, which is low dose oral minoxidil, as long as they don't have cardiac issues, 1.25 milligrams a day, taken at bedtime. And the second one is going to be PRP treatments. So doing, really good PRP can thicken up your hair. And just a little aside, I've been doing PRP for over 8 years, and it all came because I lost a lot of my hair, and that happened. I have androgenetic alopecia in my family. So I started out thin, I started thinning, had my second baby, who's now 9. But 7 years ago, he was 2. And I'm thinking, gosh, my hair needs to come back. That telogen effluvium should have been over. And on top of that, I have Hashimoto's for the last 15 years. And anytime you have a flare of any autoimmune disease, your hair gets thin and all those things, especially when you have a background of androgenetic alopecia. When you have an insult like a physiologic, like chemo, or a baby or anything like that, or something emotional like a move, a divorce, a new job, all those things, your body kicks the hair out of the anagen, the growth phase, into the falling out phase. And when that happens, it's hard to recover when you have a genetic predisposition to having low circulation in your scalp. And that's why PRP is so helpful. And that's why oral minoxidil with the vasodilation is so important. And that's why after these treatments, maintaining on a hair cap, a low level laser therapy is so great.
Perfect. And just to clarify, all of these treatments would be prescribed through the dermatologist typically, like
Yes.
the low minoxidil. Okay, great.
Yes, I haven't heard of another specialty besides hair transplant prescribe that, but yes.
Okay, one.
Yeah.
Perfect. Thank you so much. Okay. So on to the next questions. I'm going to keep going with one more question for Neda, and then we'll kind of try to do this in pairs because there's so many questions for both of you. But Neda, could you tell us, so there's so many trends on social media. How do you know which ones to follow? Are there like guides, or like how do they know which ones are true, which ones are not true? Because it's just confusing.
I would tell you it has to do with just in general. I mean, anytime you hear anything from anyone, I don't get plumbing advice from my electrician. I don't get my skincare advice from an influencer. Just take
Yeah.
it to a dermatologist. Take it to your dermatologist. Or if you see it on your favorite dermatologist page, ask them about it. Have them talk about it, or see if they have any content on it. But just because you're a pretty face doesn't mean, and you develop your your lifestyle from your looks, doesn't suddenly make you an expert, right? And so that is my take home message. There was a TikTok that my son shared with me of, oh my gosh, mom, there's this new TikTok dance that when two people stand, and when you kick their legs, they fall back and they hit their head and they die. Mom, like, this is crazy. And I'm like, yes. So the next time someone comes and says, hey, I saw this on TikTok, don't have the NyQuil chicken, and don't get your head, on a concrete floor, so that's what I have to say about that.
Okay, perfect. Thank you. That's good advice. So Preeti, we have some questions, a lot of them about vitamin D. So is there a particular vitamin D supplement that you recommend? And then kind of piggybacking a similar question, should I take vitamin D and calcium together?
Um, So those are really good questions. Okay. So vitamin D, if you have to get tested, try to get tested for it. And I know the recommendation is to be in sunlight, but a lot of time when we are working, we are inside, and there's a very short duration of time when actually your body can absorb vitamin D from sunlight, which is between 2 to 4, and then you have to have all your arms and legs out, and nobody has that much amount of time to do it. That's why you want to do like dietary sources like mackerel, mushrooms, salmons, and a lot of those fishes have a lot of good amount of vitamin D, or a lot of like now foods have been fortified with vitamin D, like your juice, your milk sometimes have it. So making sure you include that. Talking about the right kind of vitamin D, I would always say check with your doctor for it, because depending on your need, it could be vitamin D with calcium with magnesium, or it could be vitamin D with K2, or it could be just vitamin D and calcium together. But remember, it's what you can take. Like I have several patients who take vitamin D with calcium. Have you seen the size of the pill? I mean, I cannot take that big of a size of a pill. So now they have started doing like a miniature one that some people can tolerate. So again, talk with your doctor, talk with your what would be right depending on your lab, And I know a lot of people take magnesium supplements for help with their neuropathy or something like that. Again, if you are not deficient, you don't need to take those things. I think having a balanced diet will give you all those nutrients. I think I might had a recommendation, which I looked up in the study that I was doing. So calcidiol supplement is more affecting and making it advantage for cases with very low or difficult to raise vitamin D serum level. So that is something that you may want to consider taking it. Again, I am not prescribing anything. It needs to be checked with your doctor before you include that. And then
Yeah. most of the time that the lab work is ordered through your primary care physician, and they can definitely help explain and go over how, if you are low, based on how low you are, whether you need a loading dose of vitamin D and then just a supplement to maintain. But it is something that they should probably be going through their physician for, especially because of what you mentioned. Taking too much of a vitamin you don't need is also not good. So it would really be if you're vitamin D deficient, and that is linked to breast cancer risk. Okay.
Can I just piggyback on that real fast? So when patients come in for alopecia, I always run my standard panel, and it includes vitamin D and also folic acid, folate, all of those things. And so when vitamin D is not optimized, and typically for the lab we use, the number is 60, every lab is different. I recommend vitamins that are third-party purity tested. So my favorite is Nordic Naturals. I don't know if you guys have heard of that, but they sell it on Amazon. Of course, you want to make sure it's a verified seller, but Nordic Naturals is awesome. And it's where I get my vitamin D. And it's excellent because at the end of the day, it's not going to have all that garbage that Preeti was talking about. It's not going to have the lead. It's not going to have the mercury. It's not going to have the cadmium. And it's awesome. So Nordic Naturals for the omega-3 as well as the vitamin D, because low vitamin D, you get hair loss too, and you get dermatitis. So yes, and you get breast cancer. So honey,
like everything that goes with, isn't it? I think there was like studies during COVID that vitamin D deficiency led to worse outcomes with COVID too. Yeah. So everybody needs to get their vitamin D levels checked for sure.
Definitely.
Okay, we're going to keep going. Preeti, I did 2 questions for you. I'm going to ask you one more question. I'm going to move back to Dr. Mehr, but somebody's asking about probiotics. Should they be taking them? Are they safe?
Probiotics, basically, now a lot of studies are being done on the gut health, how gut health is related to your metabolism, it is related to your mental health, and there's a lot of studies coming. And because, we eat so much refined foods, we eat so much processed food that we don't have healthy bacteria, and people develop IBS, IBD, and all those kind of GI issues. So probiotics should always be taken in certain conditions, and again, it depends on what kind of condition you have. Like people, sometimes when they're taking antibiotics because they kill all the good healthy bacteria, it can take up to 6 months to generate again those healthy bacteria. So having a probiotic with it would be very helpful. Or you are traveling and you have those traveler's tummy, we say, then you can include a probiotic. And or you have IBS, again, not knowing what kind of probiotic you can include, just going out over the counter and grabbing something, that will not be very helpful. So make sure you talk to your dietitian. What kind of probiotic should I be doing, and what should be the strains, or what should be the level, CFU levels for a probiotic. So make sure you talk with them. And then again, probiotic and prebiotics, they both are important. So, and a lot of food sources have probiotic, like your yogurt, your kefir, your kombucha, your fermented foods, and your pickles. So they have a lot of probiotics. And then prebiotics are basically non-digestible fiber, which is included in your bananas, in your asparagus, in your chicory roots. So having, again, as I said, balanced diet, more greens, and will help you get those all healthy bacteria, and your mental health will improve, your metabolism will improve, and overall quality of life.
Wow, I love that you know so much about all this stuff. We're going to do one more question each, because I know we've kind of run over time, and I know people probably want to get to their families and other tasks for tonight. So 2 more questions, and then you can also send an email to hoagevents@hoag.org for you to ask more questions, and hopefully we can kind of touch base with both of our speakers and get some of these questions answered that we can't cover tonight, because there's so many great questions. But I'm going to end with one more question for you guys each. For Neda, you mentioned something very interesting about certain skin products having estrogen without patients maybe knowing about it. So a really good question was, on those products, are they labeled that they're estrogen inside the products, or these are things that patients wouldn't necessarily know because it's not on the label? So then how would they identify if some of the skin products they're using have small levels of estrogen in them?
I love this question. So again, it goes back to FDA approval. The FDA does not regulate vitamins or cosmeceuticals. So things that you take in or the things that you put on your skin. And we know, hello, oh my gosh, the skin's the largest organ. And if you're putting, all these parabens and all these chemicals, this is problematic. And so no, they don't list it. And no, they don't need to list it. And so that's why it's really important to do either medical grade skincare, clean skincare, or verified fragrance-free sensitive skincare. And that's why it was really important for me to show pictures of what is Vanicream, what does it look like? If you're worried, there's a great glycerin ceramide hydration. And if you actually want the active stuff, use those that are cosmeceutical medical strength.
Wonderful. Thank you. That's like such great information. That's actually something I didn't even know. I always learn something new from these events. So thank you so much. And then Preeti, one last question also for you. And then just remember, everybody, you're going to be getting a survey tonight. Please fill it out. We would love to have more talks like today and get your feedback. And we had some wonderful speakers, and they've also included in our newsletter little tips and stuff from each of their talks. So that'll be something for you to look out for. So Preeti, is there any benefit to drinking matcha green tea?
That's a really good question. So matcha is almost like a more concentrated form, and there's a lot of tradition, like a lot of it's like it's in like matcha latte, and it's added to either your water or your juices and everything. Again, it helps with your immune system. Um, Again, how sensitive you are to, like, I cannot do matcha, because when I take it, I get so much bloating. My stomach kind of hurts. I tried several times, and I don't think so it's meant for me. So again, these superfoods are not for everyone. It's okay to try it. It's okay to have it experience, but again, having it consistently and making in a bigger boost doses may not be very helpful. But green tea is a more moderate form. Matcha is has much more caffeine in it sometimes. So be cautious of the side effects, but otherwise, it's safe to take in moderate amount.
Okay, perfect. Well, thank you both again. This was such a wonderful event, and we really hope everybody on our live stream enjoyed it. Just remember, it is recorded, so if you missed something, you can always kind of reference back. And we hope you guys tune in for our next event. I think it was June. Thought I wrote it down. June 14th is our next event from 5 to 6 p.m. So please look out for information on that event and any of our upcoming series. And then thank you both so much for joining us tonight. You both did such a wonderful job, and I hope everyone has a great night.
Good night. Thank you. This was so fun. Thank you, Dr. Khan. Thank you, Preeti.
Thanks,
Thank you,
Scott.
Dr. Khan. Thank you so much, Dr. Mehr. And thank you so much for all my audience to come and spare your time and watch us and learn and listen to us. Thank you so much.
Awesome. Thanks, guys. Have a good night.
Thanks.
Bye.